Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID pandemic update for the week ending Thursday, April 8th, 2021. The three questions I have this week, as always, I'll ask how is the pandemic progressing globally in the US and in our region. I've asked this before, I'll ask it again, are we approaching herd immunity? And then we had a question from a viewer about what is emergency use authorization? What does it mean? In terms of the pandemic, we're getting very close to 3 million deaths worldwide. We saw a 2.5% week-to-week increase last week, which is a little bit worrisome because in the last 2 weeks, the rate of increase has been greater than it has been for most of the past month or so. Still well below what it was before, but that's a little bit worrisome. And that translates into 73,000 deaths over the last week. That's 7 deaths every minute. So don't for a moment think that this pandemic is not still progressing. What worries me also is if you look at this tail end, this is the daily number of deaths going all the way back to March. We had that spike in the spring and then the big jump in the winter time. It's been coming down for a while, but the last couple of weeks, no question, the number of daily deaths has been going up. What's interesting is, unlike what we were seeing early in the pandemic, where most of the countries were showing the same pattern, we're seeing quite different patterns in different countries. This shows Brazil, India, France, the United States, countries that are in the news all the time with very, very different patterns of how the pandemic is progressing. The one thing that is consistent is that deaths per million continues to go up, and the US continues to be in the top 10 of all the countries in the world in deaths per million. In the US, we've had 570,000 deaths at a 1.3% week-to-week increase, which is a little bit below what the rest of the world is doing, which is good, except that you see the last couple of weeks, we went 1%, then 1.4, 1.2, 1.3. We've got to keep an eye on that. Even with that, there were over 7,000 deaths last week, which is almost 1 death every minute. And as I showed you before, we've seen this pattern where there was a spike in the springtime, again in the summer, and then this big spike in the winter. It's been pretty consistently coming down. We were keeping an eye on that flattening, but it seems to be coming down. So we'll keep our fingers crossed on that. This is where all the cases have been in August, September, October, November, December, January, February, March, and now April. And what you can see is it's continuing to spread, but especially here in the middle part of the country, the upper Midwest, sort of the central Northwest. But I'm also keeping an eye on the resurgence in the major metropolitan areas. That's a worrisome trend. We want to keep an eye on that. In terms of our region, the number of deaths are quite different. If you look at deaths per million, South Carolina and Tennessee continue to be about 50% worse than the other 3 states in the region. But in the last week, all of the rates have been slowing down, most of them about where the US is overall. But point of comparison, South Carolina and Tennessee still have more deaths per million than the nation overall. In terms of the ballot health region, if you look at deaths, it really has been slowing down, which I hope is going to be a consistent trend. Even with that, there was more than 1 death every day last week, which of course is not a good thing, but at least it's slowing down. But what worries me a little bit is this is hospitalizations going back to August. And you can see from August to the beginning of October, about 100 hospitalizations a day. Then it skyrocketed up into the 300s and it dropped quickly, but now appears perhaps it's going back up. So again, it's something we want to keep an eye on. So how's the pandemic progressing? Globally, it appears to be picking up speed, still slowing down in the US, still slowing down in our region. We'll keep our fingers crossed. We'll keep watching it. One of the issues that comes up is herd immunity. This is this idea that if you get enough people who are immune, either from immunization or natural infection, that the disease will stop spreading. No one knows for sure how many people have to be immune, but it's been estimated somewhere between 70 and 90% of the population would need to be immune. In Tennessee right now, 1.1 million people have been completely vaccinated. That represents 16.7% of the population has been completely vaccinated, and about a quarter has received one dose. These numbers are a little worse than the nation overall, but not significantly worse. So that's the percent that's been immunized through vaccination. And then there have been 800,000 reported cases, almost 12,000 deaths. So at least 807,000 people are known to be living with the disease. That's about 12% of the population. So just on that, we have about 29% of the population that should be expected to be immune and 71% not. But what we know, of course, is there are many people who were infected with COVID that were never diagnosed. The CDC has estimated that there may be 4.6 infections for every one that's known. If that's the case, then we're up almost about 70%. We're getting very close to what would be herd immunity in Tennessee. This may be a high number. There's another estimate that's been published that puts about 38% of the population having been infected. And so that would put us at about 50 to 55%. So we're not at herd immunity yet, either nationally or in Tennessee, but hopefully we're moving towards it. Now, there was an article published recently about why herd immunity may be impossible. I don't think it's impossible, but these are reasons to be concerned about it. One is it's not absolutely clear that even after you're vaccinated, you can't spread the disease to someone else. Vaccine rollout is uneven. There are people in our country that are declining to get it. They become a source of infection for other people, but it's also uneven globally. And if you think about it, if this disease is spreading in sub-Saharan Africa, it can come back to the States at any time. New variants change the equation. Right now, it does not appear that new variants will evade our immunity, but they may. Immunity may not last forever. And vaccines, of course, once you get vaccinated, if you go back and start doing all the things that you used to do, the virus will continue to spread. So this particular article talks about the importance of thinking of normalcy rather than herd immunity, and about COVID becoming a chronic condition. That may be true, but I think it's a little bit too early to throw in the towel. We need to keep working to get people vaccinated, and in the meantime, we need to continue to do the things that we know make a difference. Finally, we got a question about what emergency use authorization means. For those of you that are interested in how vaccine development happens, I have a video on the website called When Will We Have a Vaccine? But this is something different than the normal approval process. An emergency use authorization allows medical countermeasures, including vaccines during public health emergencies. And while we think about it for COVID, it was actually designed also to help protect us against chemical, biological, radiological, or nuclear attacks or infectious diseases at a time when we don't have any other approved medicine. So what if someone, if there were, we hope not, an attack on our country or a new infectious disease that we simply have no protection against, we have to have a way of getting a promising product out as quickly as possible. And these products could be a biological product such as a vaccine, or drugs or devices like tests or personal protective equipment. But the idea is we have to be able to use a scientific process to get promising products out as quickly as possible. And once the emergency use authorization has been issued, the manufacturers have to continue to do their studies. So there's a document that's in the reference I showed you on the last slide, and it talks about this systematic process, right? You collect data beforehand, you start conducting clinical trials. There's a data safety monitoring board. And then once there's enough data, it's submitted to the scientists at FDA. They convene a meeting of an outside advisory committee. They review the information and then ultimately issue an emergency use authorization so that people can be kept alive during public health emergencies. It hasn't been used much. It's only been around since 2009, but it is an important tool to help us respond to disasters. So the pandemic appears to be picking up speed globally, but slowing down in the US and in our region. We are moving in the direction of herd immunity. We hope we can get there, and I've explained what emergency use authorization means. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to this mailing list, please let us know. As always, I'd like to thank Melissa White for helping to collate the data and Dara Young for editing, producing, and posting this video. Most importantly, I want to thank you for your questions. Please let me know if there's any issues, any uncertainties about what I've said in this week or any previous video, or any information that you'd like me to provide or questions you'd like me to address. Until we meet again, hope you are well. Take care. Bye-bye.